human bone marrow growth factors in skincare. Now, they're in many things, but in the case of what I often talk about, it's growth factors in PRF that I take from people's blood and put back, but it's in the post-care. And I've done videos on the healing powers after procedures such as lasers, but I'm walking down the hallway at a conference and there's Ian Sanderson, the CEO of Anteage, the skincare line, and the growth factor serums that I use when my patients go home post-procedures. You can use it for lashes. You probably hear about growth factors for hair stimulation and just about everything. I cornered him and I said, hey, let me ask you a couple questions. I didn't prompt him. This was spontaneous, and I'm going to show you that really quick interview so you can watch and hear it from yourselves. For some of you, you might be shocked to learn about this. There's a lot of theories as to where they come from, what happens to the bone marrow. Are people paid? Are they harmed? Does it hurt? And he's going to answer exactly those questions. 2 quick points before we get into it. What are growth factors? Why are they important in skincare? Well, they don't cause irritation like retinols can, like peels or inflammation. In fact, they're signals to signal the body, the cells, for a biological reaction, if you will, a biological mechanism. And in our case, we're looking for healing, reducing the appearance of fine lines, maybe of brown spots. I talked to some people, their reds and rosacea go away. People use them for hair. All over, you're going to hear more and more about these signals because they're very important. Secondly, where could you potentially get them from? Well, there's embryonic and umbilical cord. We'll remove that because those are more controversial and certainly not what we're going into today. But common sources would be bone marrow, which is today's video. Fat is rich and probably the richest source of stem cells that you can get. You hear a lot about fat transfer, stromal vascular fraction, and so on. And then blood. So in my videos on platelet-rich fibrin, PRF, PRF gel, plasma eyes, plasma brow, all those use one's own blood and then we put it back. Today it's bone marrow. Let's hear right from Ian because it's the most asked question I get on the Anteage growth factors and growth factors in general. Okay, I'm at the A4M. I'm with Ian, the president of Anteage, and there is a new eye cream I'm going to tell you about, but I wanted to ask him, where do the growth factors come from? Let's hear it right from him because everyone wants to know.
So this is a question we get asked all the time. So the growth factors in the Anteage products, they come from human bone marrow stem cells. And everyone says, oh, where do the stem cells come from, right? They don't come from babies, they don't come from anything like that. They're actually from young adults, 18 to 20 years old, who are consenting donors. And it's a procedure where they're compensated very well, and we get that bone marrow from them. Just a little bit. They've got more than they need, so they donate a little bit of it. And then in our lab, we grow the stem cells and the growth factors come out of those, and then the stem cells are removed. So actually, the products don't have any cells in them. You're just getting the pure human biosignals that you need.
So there's no cells in them, and then how many people would you need? Like how much can you grow from one harvesting, we'll call it? Is that fair to say?
Yeah. So actually it's very surprising. A small aliquot, a little donation of bone marrow will be enough for us for maybe 6 months or even a year sometimes, depending on how productive the cells are, because we call clonally expand the cells, and so they keep producing and producing and producing as long as we treat them well. So we're very efficient in the way that we use the bone marrow stem cells.
Very interesting. So you really don't need a lot and you can produce a lot of product.
Exactly. As long as we treat them well, they'll treat us well, and we get all the growth factors we need.
And that factory, where would that be?
So that's in Irvine, California. We actually have several labs in Irvine. We have a research lab and a production lab. And I'd love for you to come and see the new lab we're actually moving into next year, a bigger one, because we need more space.
Well, I will be there, but everyone asks that, Ian, where do they come from? And people get a little bit freaked out hearing it from you. I tell them all the time, sometimes they don't believe me or listen to me, but hearing it from you, because you're at the factory, you're at the lab, you see it firsthand.
Yeah, exactly. So yeah, we're very tightly controlled in our process, and we're really one of the few companies that produces skincare products with growth factors that we actually culture our own cells. We have our own stem cell biology lab, so we really pay very close attention to that core ingredient, the bone marrow stem cell media.
Now this eye product I have here, I'm going to be trying it. So this has some growth factors in it as well as other factors?
It does. It has growth factors, it has bakuchiol, it has lifting and brightening ingredients for the eyes. So this is pre-release, it's coming out in January, but Dr. Rajani will give you his reviews on it soon.
Well, I'm not letting anyone else have this. I'm going to give it a shot. So there you go. That is right from Ian, all about growth factors. Now you probably have more questions on this. Just ask, because it sounds like you're willing to answer.
Yeah, maybe we could do an Instagram live or something. I'm happy to get deeper into it.
Awesome. Okay. Well, we're going to do a YouTube live too, because the YouTube. Don't forget about the YouTubers.
No. You're the guy.
Okay. Thank you very much. There you go. Any questions? Ask in the comments below. If you like these, you like to hear from people, click the like button, and of course, subscribe. See you.